To play sports on any level, conditioning is of the utmost importance. But regardless of how well conditioned an athlete is, injuries happen. One of the most common sports injuries is a torn ACL, or anterior cruciate ligament, which is one of the 4 major ligaments in the knee that provides stability to the joint.
The cause of an anterocruciate ligament or ACL tear is trauma. Trauma can be direct or it can be indirect. A direct trauma, as an example, would be a football injury when an athlete gets clipped and the knee buckles. An indirect trauma would be an example of a basketball player whose foot is planted on the ground. The body goes one-way twist on that planted foot that will produce an acute pop and therefore tear of the anterocruciate ligament.
The ligament itself is made up of thousands of individual fibers that together form the ACL. Some of these fibers are organized into distinct bundles. In order to restore stability to the knee, physicians often recommend an ACL reconstruction to insert a new ligament in the place of the damaged ACL.
The typical single bundle anterocruciate ligament reconstruction is done with 1 graft, 1 hole in the leg bone, tibia, 1 hole in the femur or the thigh bone, and the graft is fixed at tension to try to produce stability. So a single bundle is 1 graft to reconstruct the anterocruciate ligament.
As modern medicine better understands the basic science and anatomy of the ACL, and as technology has improved, orthopedic surgeons now have the opportunity to more closely replicate the natural anatomy of the ACL.
The success of anterocruciate ligament reconstructive surgeries over the year has been quite good. Unfortunately, it's not perfect. With all comers, it's about 90% good and excellent results, which is very good, which has allowed us over the years with the advent of new techniques to get a lot of athletes with a devastating career-ending injury back to their sports. Unfortunately, we do have a 10% failure rate.
A new surgical method called the double bundle ACL reconstruction procedure has been improving outcomes for patients.
A double bundle ACL reconstruction is different because we used 2 grafts with 2 holes in the tibia or leg bone and 2 holes in the femur or the thigh bone. And the grafts are placed at the appropriate anatomic locations to not only prevent anterior translation or movement forwardly of the leg bone and thigh bone, but also to control rotational problems, which is more problematic for athletes in their ability to play sports.
The double bundle is a more complex and time-consuming procedure, and there are fewer surgeons with experience in this new surgical technique.
Double bundle ACL reconstruction requires a lot of expertise on the part of the surgeon. I believe that any surgeon that has significant arthroscopic experience can perform this procedure. It requires basic anatomy and understanding of where the different landmarks are to perform it. It's much more difficult than a single bundle procedure, but certainly any experienced arthroscopic surgeon can perform this procedure very accurately.
Dr. Howard Freedberg, an orthopedic surgeon at Suburban Orthopaedics in Bartlett, Illinois, outside of Chicago, offers 20 years of orthopedic experience. He is a consulting physician to the Players Association for the NFL and Major League Baseball. In addition to working with professional athletes, Dr. Freedberg is the team physician for multiple area high schools. Dr. Freedberg has performed numerous ACL reconstructions, many of which have been double bundle procedures.
I have found that the double bundle anterocruciate ligament reconstructive procedure has been extremely successful. I've had patients that have been very happy with it. Quite in fact, in my experience, it's been the most successful and I've been the happiest with this procedure. We have been able to produce more of a normal knee for the patient, and that is the goal. If the patient feels that their knee is normal, then they will function normally, and their benefit to the patient is exponential.
I tore my ACL playing soccer during a scrimmage game, and I just landed on it funny and it twisted to the side. I had my reconstructive surgery on August 22nd of last year, and I've been doing very well since then. I was in physical therapy for about 5 to 6 months, and now I'm just doing more sports-related stuff, trying to get my conditioning back and just get back into shape.
Nationally renowned, Dr. Freedberg is a master instructor of arthroscopic surgery and an instructor for the American Academy of Orthopedic Surgeons. He lectures on his theories and techniques on subjects such as shoulder and knee reconstruction.
I feel that I'm unique to do the arthroscopic double bundle anticruciate ligament reconstructive procedures because I've done over 1,000 in my 23-year career. I am always trying to improve on the procedure. 90% success rate, in my opinion, is not optimal. Having been able to evaluate and learn the procedure in Germany when I was there, I feel it is leaps and bounds a better procedure in the long term with a higher success rate, and I believe I'm unique in being able to perform it.
In addition to ACL reconstruction, Suburban Orthopaedics specializes in a variety of orthopedic procedures, both minimally invasive and non-invasive, for the knee, ankle and foot, hip, shoulder, wrist and hand, elbow, and spine.
Some of the exciting new procedures in the spine are focused on motion sparing. There is the total disc replacement for both the cervical and the lumbar spine. There is the X-stop interspinous process decompression procedure, and the X-lift, which is a minimally disruptive technique for fusing the lumbar spine.
On March 13th of this year, I had cervical spinal surgery from Dr. McNally. I suffer from degenerative disc disease, and my arms and hands had become numb, and it was quite painful. And it's all corrected now, and I'm doing much better.
Dr. Thomas McNally is board certified by the American Board of Orthopedic Surgery. Dr. McNally has lectured on various topics including minimally invasive surgeries, kyphoplasty, and X-stop. Dr. McNally is an expert in comprehensive operative and non-operative spinal care. He utilizes a team approach to provide his patients with support for all aspects of their spine health management.
The future trends in spine surgery will include genetic markers. There is already a genetic marker for adolescent idiopathic scoliosis, which allows us to decrease the amount of x-rays that adolescent girls will be subjected to during the course of the treatment for their adolescent idiopathic scoliosis. There will also be genetic markers that are used for degenerative disc disease that will help surgeons treat the appropriate levels in various patients.
The physicians and staff of Suburban Orthopaedics are dedicated to providing the highest quality orthopedic care. They are committed to improving the quality of life for their patients through giving comprehensive and compassionate care. For more information or to make an appointment, contact Suburban Orthopaedics or visit suburbanortho.com.